Good afternoon, everybody, and welcome to our Friday afternoon news conference for the city of Grand Forks. To members of the media, we've gotten quite routine at this. We will have comments from our panelists, and then we'll open it up to Q&A. Please remember to use your raise hand feature within this Zoom meeting so I know to call on you, and we'll get to as many questions as we possibly can. Like we have done with these in the past, we will open with Mayor Brown.
Now more than ever, it's important to stay home to contain COVID-19. Yesterday, there was a private COVID-19 testing event conducted by Grand Forks Public Health, the North Dakota Department of Health, and the North Dakota National Guard for pre-identified LM Wind Power Plant employees and their close contacts. A total of 425 people were tested. The city of Grand Forks, the state of North Dakota, Altru Health System, and the corporate entity are working effectively together to identify, mitigate, and contain COVID-19 as a result of recent events. I've been in contact with Governor Burgum and General Dormer of the North Dakota National Guard, and they have assured us that the state of North Dakota is supporting Grand Forks to their fullest capacity. These mitigation and testing efforts occur through a partnership between the public and private sectors. You, as citizens of Grand Forks, are part of that partnership. The responsibility to ensure that we do not overrun our healthcare system falls on each and every one of us. Stay home for the nurses and doctors at Altru. Stay home for our public health professionals. Stay home for our police officers and firefighters. Stay home for our public works and waterworks crews. Stay home for our sanitation crews, and ultimately stay home for our friends and loved ones. We must take responsibility for the health of ourselves and for our neighbors and follow CDC guidelines. Stay home. Only go out in public for essential trips. If you go out, wear a face covering. Wearing a face covering is not a substitute for physical distancing measures, but an additional guideline to protect yourself and others. If you're a business providing an essential service, it's imperative you take all the necessary precautions to protect the health and safety of your customers and employees. Providing face coverings and gloves for your employees is no longer a recommendation, it's an expectation. Reducing numbers of checkout lines, creating one-way aisles, strategically positioning hand sanitizing stations, and placing floor markings every 6 feet near checkout lanes are good measures to take. We have signage available for you to use at grandforksgov.com/resources. In partnership with the state of North Dakota, there are adequate government restrictions and recommendations in place at this time. Dr. Fauci has said the restrictions are functionally equivalent to shelter-in-place orders in other states. We have the right framework in place, provided that the citizens and business of Grand Forks abide by the physical distancing guidelines. Our efforts are federally supported, state managed, and locally executed. We're following Governor Burgum's strong and data-driven leadership and are ready to act further at the local level if necessary. We understand this is a fluid situation and we are monitoring it closely. Next, we'll hear from Dr. Stephen Weiser, President of Altru Health System.
Thank you, Mayor Brown. As Dr. Brown just alluded to, our partners in public health held a mass testing event related to a cluster of positive COVID-19 cases that occurred at a local business, LM Wind Power. While this is still under investigation and we don't have the final results, we know that this is a very serious event. As the president of our community hospital, I'm pleading with you to follow the recommendations that the mayor and others have repeated over the past month. Stay home, don't touch your face, wash your hands, and if you can self-isolate, please do so, especially if you or your family are considered essential workers. These are simple steps you can take to prevent serious illness and an overwhelming impact on our community. While we've spent endless hours planning and preparing for spread in our community, the potential impact we now face has the ability to overwhelm our healthcare workers and our health system. The healthcare workers in our community need you to step up. We in the medical profession are committed to the well-being of our community. Our team is on the front line and they will stay there. They need your partnership to keep them safe and to keep them working so they can care for you. I'd also like to speak to you today a little bit about testing in our community. It's very important for you to understand that nationally, in the state, and even in our community, testing kits are limited. North Dakota is no different than other parts of the country. While we understand that testing can bring peace of mind, Altru and our partners in public health must follow guidelines to ensure the availability of tests for those who need them the most. This is another reason why practicing the recommended steps of safety as a community is imperative in managing this response to the pandemic. I thank you in advance for your cooperation and attention. This is a big deal. We need you to take this seriously and respond appropriately. We are all in this together. Thanks again, Mayor.
Thank you. Dr. Walls?
Thank you, Mayor. As the Grand Forks County and Grand Forks City Health Officer, I have the responsibility for the health and safety of all the residents of Grand Forks County. During this COVID-19 pandemic, the local health officer's responsibility becomes even more important to prevent the spread of the contagious disease and provide containment. The only tools we have to prevent COVID-19 are social distancing, frequent hand washing, avoid touching your face, wearing appropriate masks depending upon your risk, and staying home if you are sick, and not gathering in groups. These measures are important for disease prevention since we do not have a vaccine for COVID-19. It is a highly contagious disease. Our public health goal is to protect the healthcare systems and ensure that we have appropriate resources when needed. We want to protect the most vulnerable residents of our community, especially the elderly and others with chronic health conditions. As a family medicine physician at Altru, I've been visiting a long-term care facility to monitor residents for illness and see patients as needed, as well as to ensure that the workforce is healthy and adequately protected. Yesterday, I had the opportunity to participate in the worksite testing held at LM Wind Power. I was able to provide medical expertise and do some of the testing. I was impressed by the partnership between Public Health, the National Guard, the City of Grand Forks, LM Wind Power, the North Dakota Department of Health, the CDC, and others involved. It led to testing of more than 400 people. The cooperation of all involved to get this done was tremendous. This will give us valuable information about the spread of COVID-19. The next step will be to conduct contact tracing and follow up any individuals who are positive. I'd like to thank the residents of Grand Forks for their prevention measures. It has been working to reduce the spread of COVID-19. Thank you.
Thank you, Dr. Walls. Earlier today, I spoke with Tim Brown, head of the public affairs with GE, the parent company of the LM Wind Power Plant, and he provided a statement that I would like to share. He says, "We appreciate our partnership with the mayor and all the city and state and public health agencies in keeping our employees safe, which remains our #1 priority. We employed our employees and their families for cooperating with State Department Public Health to ensure that the testing was as complete as possible. Likewise, we want to applaud the National Guard, the city and the state public agencies, the mayor's office, and everyone else involved in running the testing process. We will provide our partners in the community more information on our plans for the reopening of the facility in the coming days once we have the test results." So next, we would like to go to John Bernstrom for questions and answers. Mr. Bernstrom.
Thank you, Mayor. And to the media members, please use your hand raise feature, and we will get to your questions. Our first question is going to come from Mr. Neil Carlson from iNews. Neil, I've just opened your mic. Go ahead, Neil.
Dr. Weiser, you've said called this a big deal. You says that the potential to overwhelm the health system. Do you have any modeling numbers regarding LM Wind Power, 400 and some tested, and how many positive cases they have so far?
Very good question. At this point in time, it takes between 24 to 48 hours to get the numbers back. They did test over 420. We have 15 positives that we know of already. One of the things to consider when modeling is the number of initials that develop, and then you take that by the population at risk. So the population or the workforce of LM is 880 personnel. They work approximately 100 to 150 on a shift. And with their families in total, it's approximately 2,500 people with direct contact risk. So what we're really going to be relying upon is what they have found out from the State Department. And we should know within the next 24 hours what those numbers look like. So really can't make any projections, but it certainly has the opportunity to be a very substantial large number, and in keeping with that, in our partnership with the city and discussions with the state, the reason for such robust testing quickly is to allow us to be able to react to that and contain it really from the get-go. And this public service messaging to our community about the importance of following the safe measures we've put in place and enforce them is the biggest opportunity to control further spread.
Thank you, Dr. Weiser. Next question coming from Mr. Dave Kolpak. Go ahead, Dave. Dave, you have to unmute yourself.
How's that?
Uh,
I know the saying out there is to.
Dave, can you start over, please? I'm sorry. Go ahead.
Okay, can you hear me now?
Yes, we can.
Okay, for Dr. Walls, I know the saying out there is to hope for the best and prepare for the worst. What would be the worst in this situation?
Well, of course, we're talking about volume of sick patients, and obviously as they get sick, we can kind of project, if we look at other numbers, the percentage that might end up in the intensive care and needing, the full support of ventilators. That's really what we worry about, is being able to handle a potential large volume in a very short time.
Thank you, Dr. Walls. Next question coming from Ryan Cunningham with KNOX. Ryan, go ahead.
Question for Dr. Weiser or Dr. Walls, either of whom can take it on. We have a model for this right now in South Dakota, in Sioux Falls, the Smithfield meatpacking plant. And yet the numbers in South Dakota show that only 63 people have ever been hospitalized. There have been 7 deaths. So based on that modeling, I mean, it would take an awful lot to overwhelm the healthcare resources in Grand Forks, even with this in this plant, because they have similar employment capacities. Would it not?
Well, it's a good point. However, you have to look at the age of your population at risk. And in that plant, what we're finding is the spread of exposures between under 20 to in the mid 50s. And you have to rely upon the comorbidities of the population that you're dealing with that would translate. Now, I think you're right. The numbers have turned out favorable despite a large number of positives, but you can't necessarily draw that conclusion. A lot has to do with the overwhelming health of that workforce. The fact you brought up was very thorough, though, in that 81 plus to 85% of patients get minimal to no symptoms and recover. Another 10 to 15 get kind of sick, and 5% get critically ill. But you can't predict who that is, and that's the challenge with this. And just one other, something that you can get out to the community is that the asymptomatic transmission rate is extremely large, and those are patients that manifest no symptoms. So we really have no way of gauging until we get some broad-based test results back of what we could be dealing with, and that's frustrating for all. And those modelings, while they are good, they're only as good as the data being fed into them.
Thank you, Dr. Weiser. Next question, Mr. Joe Bowen.
Hey there. So this is kind of a two-parter. First part's really simple, though. Do you guys intend to have Tim Brown, the GE spokesperson, back for another one of these? Maybe?
Mayor Brown, or I can maybe speak to that. We're speaking with GE on a daily basis, so I can't say one way or the other if you may come back just based on test results. Mayor Brown, do you have anything to add to that?
No, that we're just actively engaged in communication, and we let them know that we're having these events, and he'll be back when it's appropriate.
Thank you, Mayor.
Okay, and then kind of the other part here is, it seems like there's been a large outbreak at LM Wind Power, but not at other large employers in the Grand Forks area. What's different about LM, or what might be different? That there was a large outbreak there, but not at, say, other places where people are still working in large numbers.
Well, we're early in this process, and so I think we're lucky that we did find this. And the way to mitigate extension of this is actively to communicate to the community, stay home, follow our guidelines. So this is an epicenter. We've seen it throughout the country where these things happen. So this just happened to happen at LM Wind Power. So now we're engaging with it. We're going to mitigate it. We're going to ask people to please follow the guidelines so it doesn't spread to the community, and keep your friends and neighbors safe.
Thank you, Mayor. Next question from Mr. Neil Carlson. Neil, go ahead.
Dr. Weiser, again, if I could follow up, you said the LM Wind Power 2,500 direct contact. I'm just wondering, I mean, is there a shortage of testing supplies? It would seem like why not test everyone and then nip it in the bud if this is where this started?
It's a great question again, Neil. And just to reiterate, testing is a limited variable for the whole US population, and we're no different. So while we have the advantage of having basically a SWAT team from the Department of Health who came down to the broad spectrum testing on symptomatic as well as contacts, that'll dictate how much further testing needs to go through to quarantine and to isolate different people that are at risk. You know, once you have a known contact in a family, as an example, that's positive, and anybody, that family should self-quarantine for 14 days. And you can assume if anybody develops symptoms, they have that. So their extension would be based on the duration of those, when those symptoms started. So that is a way to actually extend your testing capability. But in a nutshell, sir, it's just the reality of the day is we have limited amount of testing resources at any given time. We have to be stewards of that.
Thank you, Dr. Weiser. Next question, Mr. Dave Kolpak.
Yeah, just two-part here too. Dr. Weiser, from my bosses at AP, they're of course all wondering, could this become another Sioux Falls meatpacking plant? And you talked about the testing and some of the issues there, but what about the contact tracing? I mean, I've tried to talk to some people in North Dakota, and they frankly told me they're under a lot of pressure here too, with their resources. Can you talk about both those?
I would ask Dr. Walls to chime in, and I'm happy to answer further if you don't get the full answer you want, please.
Dr. Walls?
Well, contact tracing is going on, and it is a labor-intensive effort. And I guess I'm not sure. Maybe I heard all the main part of the question, so maybe I have to ask you to repeat or let Dr. Weiser fill in.
Well, Dr. Walls, Dave, I don't mean to speak for you, but we hear about the pressure on testing, the pressure that's put on the contact tracing. Can you speak to that and the workload and the pressure that that group is under?
Well, I'm not talking to them firsthand, and I'm not doing that activity, so I really don't have too much to say on that. Debbie Swanson might be able to add a little more to that if you are available, Debbie, and want to speak of it.
Yes, Deb Swanson is available on the sidelines. Deb, your mic is open. Go ahead.
Thank you very much, John and Mayor Brown and members of this panel. Grand Forks Public Health Department is assisting the North Dakota Department of Health with contact tracing activities, and we have been since the very first case that was reported in Grand Forks County. We have currently 13 staff members that are doing this work, and as Dr. Walls mentioned, it is very labor intensive. It involves a lot of telephone calls, a lot of contact with individuals who have tested positive, but also with their named contacts, anybody that's a close coworker of theirs, and of course, most importantly, their household contacts. So the staff check in with individuals daily to see how they're feeling, if they have any symptoms of the disease. And then after that period of time of quarantine that was mentioned before, they're released. So every day we get new reports of people who've been added to that workload, as well as people who have been released because they've completed their quarantine period and are considered either recovered from the disease or complete with a quarantine period. Isolation is what we refer to when we talk about people who actually have the illness, and quarantine is what we refer to when people are at risk of getting sick from the illness.
Thank you, Deb. Go ahead, Mayor. Yes.
And that's why it's so important that we act as a community to mitigate the spread of this pandemic. And that's why we're getting the word out to stay home, follow these guidelines, keep your partners and neighbors and community safe. We express these concerns to our businesses, keep your employees and your customers safe. And getting the word out early is what is going to stop this spread.
Thank you, Mayor. Next question for Mr. Ryan Cunningham with KNOX.
Dr. Weiser, you mentioned that there were 15 positives already that you knew of. How many negatives have been verified from that testing?
Yeah, I can't speak to that. Those are not been released from the broad number. So we'll know, again, the State Department will disclose to us once they have all their formal testing. Those are tests that we actually did through our system based on patients we were exposed to directly.
Thank you, Dr. Weiser. Next question,
I'm a
Mr.
little
Cunningham.
confused. Yeah, I'm sorry. I'm a little confused. So those were 15 tests with LM Wind Power, or those were 15 tests that Altru did just generally in the public?
So those patients, when they came through testing, had symptoms. And in our tracing of them, and when we asked them what they did, they were affiliated with LM Wind Power, to clarify.
And Mr. Cunningham, to further answer, the results from the mass testing yesterday are not in yet. They're still at the state lab. Mr. Joe Bowen.
Yeah. So this is another community question here. It seems like Cass County is a major epicenter for the outbreak in North Dakota. And more specifically, it seems like the number of close contact cases has dramatically risen recently. Does anyone know how many of those cases are in caregiver facilities or healthcare facilities? And is anything being done to specifically keep the large proportion of cases in Cass County from reaching Grand Forks County?
I can't answer to the measures they're doing. I can say that what we've been doing with our caregiving facilities is we've remained in lockdown and protected them, and fortunately have not had to have any exposures to this point. So.
Okay, and from the media, we got time for one or two more, if there's any hand raised. If not, I don't see any. We do have Mr. Joe Bowen, our final question.
Yeah, so I just want to make sure I get like some kind of answer. This is one that we got specifically to ask in one of these. What's being done, if anything, to keep the seemingly large number of cases in Cass County from spreading up here? Because it seems like they have proportionally more.
I would think that we as a community continue to follow our guidelines.
Okay, we do have Mr. Kolpak. We'll squeeze you in here. Go ahead, Dave.
Yeah, thank you. Dr. Weiser or Dr. Walls. So I take it it's just too early in the process now to even think about any numbers that could come out of LM when all is said and done.
Yeah, I
What's your
don't.
thought? Go ahead.
I think it is too early. We're definitely very worried about this. It's potentially, again, a very large number. And so, yeah, we're all waiting a bit nervously and hopefully at the same time that, the numbers aren't going to be as significant. And so that's where I think we just sit and wait.
Thank you, Mr. Walls, and thank you to members of the media during that Q&A portion. And we will wrap it up here today with Mr. Mayor Brown.
Thank you, John. I want to thank Altru Health System and all the healthcare professionals for their tireless work and the state of North Dakota for their assistance during this pandemic. A strong partnership has been formed over the years between the city of Grand Forks and Governor Burgum's administration. We're working hard and to keep hand in hand to keep our citizens safe and healthy. We need you to do your part. The decisions you make every day help us keep safe as a community as we determine the spread of COVID-19 in our community. The virus does not spread itself, we spread it. Stay home for the nurses and doctors at Altru. Stay home for our public health professionals. Stay home for our police officers and firefighters. Stay home for our public works and waterworks crews. Stay home for our sanitation crews, and ultimately stay home for our friends and loved ones. It's time we start to be North Dakota smart now than ever. Stay home, slow the spread, save lives. We're in this together. We'll get through this together, and together we'll emerge stronger. Thank you, everyone.
Thank you, Mayor, and thank you to members of the media. That concludes our news conference for this afternoon on Friday the 17th. Thank you to our panelists, and hope everyone has a nice weekend. Thank you.